What can chiropractic do for you? Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And today we're going to talk about chiropractic and chiropractic adjusting. I think in the public, a lot of people, when you say the word chiropractic, they think back pain, adjustments for the back, and kind of limit it to that. But the chiropractic profession is so much more. This health profession really is focused on really the diagnosis and treatment and the prevention of disorders that affect your general health. And a lot of people don't understand that we treat more than just the spine. It's an emphasis in our profession really on finding or identifying the underlying cause to that health condition. And obviously we recommend treatment options that are designed to relieve pain and restore the mobility and restore function to the body and really prevent the reoccurrence of these things. We really focus on trying to keep people from ending up in surgery or being put on pharmaceuticals for the rest of their life. And when I tell people, we do a lot more than just adjusting the spine. We work with diabetics and people with hypothyroid. But a lot of people, they think, well, chiropractic, they do adjusting. And that is one component that can be done by some of the clinicians here at Zeal Integrated Health. So I'm going to spend a little bit of time. Let's talk about chiropractic adjusting, what that involves, and what are some of the benefits of that.
Right, so let's just start out with the benefits of an adjustment. You get increased joint and muscle movement. You get relief of headaches and muscle tension. You get relief of symptoms that are associated with sports injuries, as well as enhancing athletic ability, increasing flexibility. You get a relief for pregnant ladies all the time, if they're childbearing and get associated low back issues. It's very beneficial for that. People with foot and gait problems. We help people with foot pain all the time that have tried countless shoes and orthotics and things like that. We're able to apply what we know about the back, spine, and joints to help them as well.
Yeah, so this is something that we'll have people come in and say, yeah, I didn't come to the appointment because I had a headache. They don't even realize, like, hey, they could come in and we can help with those headaches. They've got issues with some of their labs, and they don't realize, like, we can help analyze that and maybe address that through some nutritional approaches to correct those issues. And then, of course, obviously we're looking at flexibility, mobility, just enhancing performance and function. You look at any major league, whether it's the football, NHL, you look at
PGA.
NFL, the MLB, all of these sports are now having a team chiropractor that's addressing some of these issues to keep them at their peak performance. So these are things that are incorporated into people's lives on multiple different levels, but it's the focus of identifying what's causing it. I think that's the thing that really separates what we do versus trying to maybe mask it with a pharmaceutical. Here's a pain med, here's some muscle relaxers, and you can take these things and hopefully it will resolve on its own. And our body does have the ability, an amazing ability to repair itself. But there's obviously some other treatment options out there using the chiropractic profession. And it can be things, that fall under manual therapies, adjusting, joint manipulations, things like that. But we also do some other things.
Yeah, we do tons of other things. You'd say joint manipulation, okay, head, neck, shoulders, fingers, toes, knees. Every joint in the body is made to move. We also do therapies, manual therapies to help get the motion fully restored. We have a lot of patients that come in that can't comb their own hair. Getting that shoulder mobility back is huge in the patient population. Things on top of that is just preventing a lot of this stuff. Giving nutritional advice for alternatives to all of the pharmaceuticals they are taking.
You bet. Yeah, so obviously there's different treatment approaches for different conditions. And obviously in our clinic, we're going to assess the individual, identify what's causing your specific concerns, what's causing you the health issues that you're struggling with, and identify the appropriate approach for that. Sometimes, it might include manipulation, it might be nutritional, it might be lifestyle changes like diet or exercise. Those kind of factors are what have to be put in. Sometimes a medication's needed and we have to, we'll refer you on to another physician for those things as well. But it's that approach of identifying what's causing your problem. If you'd like to learn more about this, check out some of our other videos and subscribe below.